Viewer from South Minneapolis wants to talk about healthcare, MNsure, et cetera. This viewer would take it a step further and say, why doesn't the legislature bring forward a single-payer health plan? The viewer thinks that would be a preferred approach. But let's talk about the viewer's question, but also more broadly the MNsure question. Representative Earl?
Well, the House plan, and I serve on Ways and Means, so actually just today the Health and Human Services bill was passed through our committee, and just some of the highlights. We have a $434 million over base. But again, there are a lot of needs. I mean, we have, as I said earlier, we talk about cuts, but sometimes it's actually reductions in anticipated increases. MNsure, under this bill, is basically funneled into the federal health exchange. Minnesota Care also into a health exchange. We are doing about $138 million into nursing homes, trying to end the rate disparity that exists between metropolitan homes and nursing homes in rural Minnesota. And another highlight of the bill is doing the 5% increase to our nursing home employees.
Well, the Affordable Care Act was the largest piece of social welfare legislation since the Great Depression. It was huge at a federal level. And the state exchange, even though we didn't pass single payer, because of the nature of the healthcare industry, it would be extraordinarily difficult for Minnesota to get there. I'm a supporter of John Marty's, Senator John Marty's Minnesota Health Plan, which is fundamentally a single payer system. But to get there from here would require a lot of work. One of those whistle stops on the line is the state exchange that we've created. But the cost drivers are so difficult for even the experts in the field to get their hands on. We dealt with this last year when we passed the Timberjay bill, which I know you're familiar with on the Supreme Court. And all of a sudden, after it was the issue relating to the Ely Timberjay, it became all about the health plans, the HMOs, and the $8 billion a year business they have for Medicaid, which of course is a part of the driver. So when Representative Erdahl talks about not meeting the increased needs, we're not meeting the spiking increased needs of the percentage that healthcare costs is rising above the rate of inflation, much more compared to the rest of the civilized world. So because the healthcare industry, in my opinion, have not been good stewards of their own cost, very much partially out of their own fault, I believe that single payer is an inevitability. It's just difficult to move right there right now from where we're at.
We pay about 40% of our state budget goes to K-12 education, and 30-some% is into Health and Human Services, and the Health and Human Services portion is the fastest growing portion of our budget. And I think Representative Lesh would agree that something has got to be done to control this cost, or it will overwhelm our budget. We won't be able to put increases into education or anything else. We'll be putting all of our money into Health and Human Services, and that's the real challenge that we're facing as we go into the future. I thought the Affordable Health Care Act was going to make things cheaper, and they haven't been doing that in many cases.
The natural tendency of the Republicans, I think, is to say, well, let the free market decide. Prices will naturally fall. And of course, that hasn't been happening. I think the only industry outside of healthcare that's been spiking above the rate of inflation more than healthcare is higher education, which is about 2/3 higher than healthcare is even spiking. But you can't just say take all the regulation out, prices will stabilize. That didn't happen. So we need to be responsible at this. And Representative Erdahl is absolutely right. But the solution, I think, is not okay, we'll just stop funding it. We'll just take more money out of Health and Human Services, which is the GOP's current proposal. Because all of a sudden, that's when you start seeing people die because their cancer treatment ends. And then we have to be accountable for them, too. And then even Republicans start saying, well, we got to do something about this. And unfortunately, up to this point, the solution has been more money given to those folks that are making money hand over fist. Bill McGuire made his billions on health care. Maybe he can help build a soccer stadium with it. But we need to find a way to reduce these costs. And right now it's a national problem, not just a state problem.
That last point I'll agree with.
I think United Healthcare is a for-profit operation. Do they even operate in Minnesota?
No, they don't. They don't have operations in Minnesota. But my point is that the entire industry affects what's going on in Minnesota. So of the $8 billion a year that the Minnesota HMOs do here, is greatly affected by United Healthcare, even though their contracts don't directly do work here.
So, since we haven't resolved the healthcare issue completely in the 10 minutes or so we spent talking about it, we'll leave that to a future program.